Ask a question, we can always spend a little bit of time to answer the questions. Anyone?
Dr. Worzel had a question. Let me see.
Yeah, please, Dr. Worzel.
Oh, yes, of course, Jimena. Hello, dear professor. Congratulations.
Yes. Okay, hello. That's Dr. Willis, is it? I thought.
Yes.
Sorry.
Yes, I can translate any doubts.
Oh,
It's
okay.
okay.
Yeah, Dr. Worzel. Okay, yeah, thank you. Good. Yes, Dr. Willis, you translate is the question, you say?
What is the question, Dr. Worzel?
You speak Spanish, so Dr. Willis can translate. Thank you.
Okay, Dr. Willis. Sabiendo que existen 5 animales que estarían representados y cuando uno ve que eso se expresa y sabiendo que pueden haber órganos agrupados, 2 órganos agrupados, si hay alguna forma de saber sobre cuál de esos órganos debiéramos trabajar o si hay que trabajar sobre los meridianos de ambos órganos.
Okay, gracias. Thank you.
Gracias.
What Dr. Walls good. What Dr. Walls wants to know if about the 5 animals, as they correspond with the organs, with some group of organs, some yin, some yang, if when the patient has a spontaneous reaction, if this kind of reaction is telling us that we should work on that type of organ, or both yin and yang, or just one of them?
Okay, okay. A good question. Good question. Yeah. So what happened was, now the yin and the yang principle come in. That's why I call yin organs and yang organ. And also we can have yin qi or yang qi. That means excessive energy and insufficient energy. Okay. So obviously other teachers, other Taoist medicine physicians or doctors, they will work with their own experience. But from my own experience, I only have 28 years, but you know, I can share with you is, if you looking back at the old text, the yin and yang principle. So for example, after I make the diagnosis, okay, with the traditional form, and also I emit energy, the patient's reacting and confirm to me, let's just say it's a running deer, right? The leg was like this, the spasm of the ligaments on the legs. So confirm to me that that was the problem with the liver. So what I'll do is I will put the 5 elements theory into it, the 5 elements. Okay, so the 5 elements, so the liver is the wood elements. Okay, so let me now, if this is the liver, all right, if this is the lines of equilibrium or balance, okay, so if it's excessive, the yang qi comes in now. If it's too yang, too excessive, okay, yeah, that means the liver qi is excessive, that people ill. And then now from here, if it's come down insufficient, it also ill is in it. So what happened is the wood elements, okay, so another organs we're supposed to control, suppress the wood to bring it down, because that means this is the superficial. The liver is the superficial, is already telling us. But the source of the problem, okay, yeah, is actually could be the lung. So after I work with the liver, I will really work with the lung and to boost the lungs energy, or let the organs of the lung energy be more excessive, and it actually balance, press down the yang energy of the liver to make it a balance again. So obviously insufficiency, and then there's another organ. So we usually work with 3 organs myself, but other doctor may work something else. But like I said, I can only share with my experience. Is that
okay? Yeah. Thank you, Professor. Because Dr. Willis tell him, please. En la medicina occidental tratamos un solo órgano, no entendemos a la combinación de órganos para que esté en equilibrio para el tratamiento.
Yes, thank you, gracias. What Dr. Worsley is saying is, thank you for your answer, and that in Western medicine, we sometimes made a big mistake, like looking only to the organ. If someone has something in the eye, they would look to the ophthalmologist. If someone has something in the teeth, he would go and wouldn't relate with other organs. So it's a very good answer. Thank you so much.
No, gracias. Yeah, we all make mistakes. The Chinese side, we make thousands of years of mistake. Don't worry. So the knowledge been accumulating wrong, and then change it and change it and change it. So it's experience is always accumulation of knowledge, isn't it? So we can share. You can share.
Yes.
Okay.
Thank you, Professor. Yes.
Yeah. Any more questions?
Yes, Ivy. Oh, sorry. Yeah.
Sorry, Paul. It's okay.
Okay. Ivy had a question, and Kelly's also got a hand up. I think Ivy's question came in first. Ivy's asking, many people who had COVID have long-lasting lung issues. Would these exercises help heal the lungs? And thank you very much, Professor Nancy and myself. Well, you're very welcome.
I knew these kind of questions were popped up. The thing is, I have been trying to avoid that. So you can see that although I've started this platform, right, due to the lockdown 2 years ago, right, because a lot of my student and my patient was asking me all over the world that they're looking at 4 blank walls, and psychologically, it's really bad for them, and they're not moving, right, sitting, locking in. So I decided to create this Zoom. That's been 2 years now. But you can notice that I don't really want to touch this subject, because I remember one night we were talking about, and somebody just bucked in and said, "Mr. Wong, you claim to, you can heal COVID-19 patients." And I said, "Sorry," I said, "you got to go." I said, "I'm Dr. Leung, I'm not Mr. Wong." So there's a lot of things happen now, which is too politicized, and I don't really want to get involved, because at the end of the day, okay, yes, we have big problem, but on the other hand, if you ask, then I'll say a little bit, but I don't really want to go into too much of it, okay? But because of all these, shall we say, the pharmacy, right? The corporation thing. So, right now, yes, it does help, because I do have a lot of people phoning me up. My patients and my students were helping me, telling me that I can. If a few of them there, if Jason Peterlina, are you there? I don't know if you're there. If you're there, you can actually tell the people. There's a lot of few people who are actually using that now, especially.
Yeah,
yeah. Sorry.
Yeah, no, I had COVID about in the first. It was.
Is it Jason? Oh, thank you, Jason.
Jason, yeah, hi.
It's the first wave. I remember you talking about it on the first wave. We don't even have any what's the name?
Yeah, there was no testing, but I had a very tickly cough in the night, and then I had a fever the whole of the night. And the next day I thought I had cured, I was fine. And then suddenly my chest tightened a lot and I had a real difficulty breathing. So it seemed like classic COVID symptoms. I went to bed as you do when you're ill, but I was too agitated and I couldn't rest. I didn't really feel like I should rest. I was like, hold on a second. I've been doing this Tai Chi with Sifu for 3-4 years now. Let's try and get the body natural medicine. I said, this is what I need to do, because I was desperate. I was actually very panicked, and I was going to almost call in the hospital. It was, you know, my mind was racing. So I went outside and I started doing the exercise, and I was able to get the internal medicine moving because I'd done enough exercise to know how it worked. And after about 25 minutes, I could start feeling it coming with my movements and my breathing, my stretching. So I did it for about an hour and 25 minutes because I was frightened, really, really frightened, even for my life, as you do in these, because there was so much sort of, you know, information. And honestly, after an hour and a half, I came in and that was it. It was gone. I felt fine. I never got COVID again. I didn't feel any tightening of my breath ever. It was gone. It was cured. It was done. What I would say that it took about a year for my lungs to recover from it. So I felt that, I don't know if it was just the lockdown, but I was jogging and I wasn't getting fitter. So there was some damage that happened to my lungs, I believe, during that process, which I think has gone now, but it took about a year to heal fully. But certainly the most important part of the COVID, I'm certain after the hour and a half, and only an hour and a half, I never had any serious concerns again. So I was very grateful, and I'm very confident that it was because I really felt I know I've done it for long enough now to know when the biochemical starts to move, and yeah, it cured. It was wonderful. I was so grateful.
Thank you, Jason. Thank you, Jason.
I have also my experience. You know, Professor, last year I was coughing. You were like checking me for three weeks, and you were saying, you're still coughing, you better check it. So, and then you asked me if I know how to do spontaneous, and then you give me some instruction. I did that evening, and I was doing in the shower, and then I was doing spontaneous, and it was hitting my lung area here like this. And I was like, my kids watched me during the showering, and what's mommy doing? So I was doing that, and 2 days later my cough stopped. And yeah, I should have done it earlier. I never thought about it though. So that's my own personal experience.
Thank you, Nancy. So Ivy, is it Ivy? Paul?
Yeah, it was Ivy.
Yes.
She sent a message saying thank you for the answer.
Okay, yeah. So 2 is enough. I can get more to come forward. But like I said, the body is a magnificent machine. So 5,000 years of knowledge, I cannot really teach you over an hour talk, can I? But at least we know that now, like myself, now I tell you that, okay, I've got about every wave, because I'm very sensitive. I'm very, very sensitive to everything. That means we picked up a lot more rubbish than anybody else. And I also, you know, I was born with lung defects from my father's side, and you can imagine that. And I always got really, really bad, you know, attack when I go for the trip. After I treat all the patients, I usually retreat, you know, and I need almost 3 or 4 days, sometimes a week, to detox, chuck out all the stuff and balance myself before I can actually goes on again. So even like the last few weeks, this Omicron, it was really terrible, I'm telling you. Yeah, I'm fine now, but my breath is still a little bit chesty. But you know, I didn't use anything. I didn't take, you know, I don't get me wrong, you have to take the vaccine if you cannot induce the natural body medicine. Okay, yeah, but like I said, I can induce myself, and so far, right, yeah, I'm keep myself okay, yeah. So I try not to take it, but if you cannot, you don't understand it, you have to take some help. You have to take some help, okay? But if you can do the Dao Yin Su and Xing Qi Su, right, it would help a lot. But you have to give me time. I can't teach you overnight. So that is the problem. That's why I didn't really want to go, you know, into it. So please do contact our controller. And that's like I said, I'm a educational promoter, or I'm a teacher. So that's my job. Okay. So, but whether you like it or not, that's up to you to decide, because a lot of people still complain that, oh, it's very difficult. But of course it's difficult. It's a medical study. You cannot just go around to do that kind of thing and get the natural body medicine going. Okay, so maybe sometimes people don't like my way of teaching, because I'm very, very sharp. I'm very, when you talked about training standard, you can ask all my students, I'm very straight. Okay, some people don't like it. So fine, you can go another teacher. So these free lessons and things and trainings maybe give us a chance that you get to know what egg research doing and see if you like my teaching methods. Fair enough? Yeah, okay. Good. Any more questions?
I saw Kelly raised her hand. I'm not sure if her...
Kelly from Africa?
Yeah.
Oh,
no, it is Kelly,
Kelly.
Africa.
Yeah.
She lives in the Netherlands, but she is from Africa.
Kelly,
Yeah,
where
that's
about
really-
Africa? You're from South Africa?
No, West, from
Oh,
Ghana.
West. Okay.
Yeah, West. Thank you very much for your lectures. It was very informative again, and I'm finding the pieces again to get it together. But I would like to share my story, because at the end you already gave more answers, because 2 days ago I didn't feel very well. I had a lot of headache and a lot of pain in my back, in my spine. But yeah, I won't go into further details, but now I'm like 70%. So I'm happy to attend this lecture to know that there's still a possibility to heal yourself, and and you need to look at your organs. But I don't know if it's something I can ask on Saturday if I'm able to attend. But how do you know what organ needs the attention? Because I understand that a lecture of 1 hour doesn't fix it, but I don't really believe in the Western pharmacy, so I didn't call the hospital to go there, so and just get through the pain. And now I'm like 70%, but for the next time, I hopefully not, it won't happen again. Just to be how do you say, be upfront, because I think before you get very ill, your body will give you some signals as well, like, hey, watch out, or hey, there's something not flowing very well. And my question is, sorry, my question is, sorry, my question is, are you going to teach how to know the signals of your own body, or do we have a group inside this lecture to contact somebody to say like, hey, this is wrong with me, or this is what I feel? You're not face to face with me, so we have to take a phone call or a video call. I hope that my question is clear, but yeah, how can you how can I help myself in this kind of situation? Because I didn't choose to go to the hospital, and I'm still alive and happy.
Good. Now, Kelly, the question is not just yourself. I'm sure the question would be many people out there. Okay. Now, like I said, I am organizing a curriculum for the Beijing University, or Sichuan University. As you can go back to check my CV, I work with many different universities in China as well. So will be a degree course. So to answer your question is yes, of course, our curriculum will cover all the stuff, but it takes time, right?
Yeah.
I can't teach you in 1 hour. Fair enough.
I understand that. Yeah.
Okay, so we talk about the learning curve, and then you understand all the principle of the 5 elements, the yin and yang principle. Now, the teaching of the Viceroy, the energies, and so all these, ancient Chinese way, of medical study. And then on the other hand, you have the training curve, because we are not using any medications. We're using like in English, mind and body. So you have to train how you train your mind, how you train your body to get your natural body medicine. So you have a learning curve and you have a training curve, and that is my curriculum is based upon. Okay, so like I said, if you're interested, you're most welcome to join us. Okay, but you have to take some time, because obviously, you know, if you want to just like, oh, close your eyes and just meditate and you can get everything, then you come to the wrong teachers. Okay, so
yeah.
that's
I want to, I just added in a text that the Saturday foundation lesson is not yet the curriculum. Saturday foundation lesson is free, but the curriculum is not free of charge.
Yes,
just to make
then
sure that otherwise people think the curriculum is free of charge.
That's the curriculum is not ready yet, so that's why we run the foundation course just as a hobby, to see, like, you don't know me, people don't know us, people don't know the egg research. So why do they? Then also this curriculum would be run, you know, by egg research, and also is associated with your university, and then that's where you get your degree from. Okay, yeah, some people don't want to go for the degree. That's fair enough. You can just join us, you know, in the, shall we say, the non-degree, right, course. It's a professional diploma course. Okay, yeah, but it's not ready yet. So it's not ready yet. Okay, so we just try to give time so people get to know us, because it's the point of you wasting your time and your money if you want to get you know, learning properly. So just enjoy yourself now with some free training, with some free lecturing. Okay, that's the best we can do. Any more questions?
Nope, those were the last questions.
Okay, so I would say thank you everyone for joining us. So I wish everyone a happy Chinese New Year, the year of the tiger. Okay, thank you.
Happy New Year to you all.
Bye bye.
Wish you all the best.
Bye bye.
And,
Bye bye.
Bye.
Thank you. Bye. Happy New Year.
Bye bye.
Happy
Bye
New
bye.
Year, Dr. Willis, Dr. Wassel,
Bye bye.
Dr.
See you
Young.
next.
Gracias. Gracias.
Bye,
Bye.
Professor.
Bye bye.